When caring for a patient with a fresh, post-op total hip arthroplasty, do you know the clinical nursing considerations to care for this type of patient? Let's find out with this easy review. Total hip arthroplasty continues to rank as one of the most successful surgical treatments for end-stage hip osteoarthritis. Healthcare professionals who work with hip arthroplasty patients need to understand the pre- and postoperative hip precautions and how they are designed to prevent exacerbation of symptoms and optimize healing following surgical procedures. Most hip fractures occur in the femoral neck or intertrochanteric area. There are three broad categories of hip fractures based on the location of the fracture: femoral neck fractures, intertrochanteric fractures, and subtrochanteric fractures. Hip precautions, in general, represent a well-established postoperative protocol to mitigate the risks of dislocations, which currently occur at an estimated total incidence rate of 1% to 3%. The goal of these protocols was to standardize the at-risk positions of the hip following a total hip arthroplasty and tailoring these positions based on the specific type of surgical technique. Pause the video and see if you can locate the most common sites of hip fracture. Your facility may implement a general pre- and postoperative patient educational component, which often incorporates these general hip precaution protocols. What is the difference between an anterior hip approach versus the posterior approach? Let's start with the difference between anterior and posterior, which is simple. Anterior means near or towards the front of something, and posterior means near or towards the back. Anterior hip replacement is a modern approach, and while it's growing in prevalence and patient preference, it is not yet as common as posterior hip replacement. Because this approach comes with a learning curve for surgeons, there are fewer surgeons experienced in anterior hip replacement in the U.S. Patients who have an anterior hip replacement are able to return to activities such as yoga, cycling, kayaking much quicker than those with a posterior procedure. There is also a difference in the size and placement of the incisions. In a posterior hip replacement, the procedure is done on the side of the hip. During this traditional approach, the orthopedic surgeon makes an 8 to 10-inch incision while you lie on your side. It does require the surgeon to cut through some muscle. The technique splits muscles along the fiber, allowing for long-term success. With the anterior hip replacement approach, the procedure is done on the front of the hip. Surgeons complete the procedure through smaller cuts, about 3 to 4 inches long, as you lie on your back. In addition, muscle is avoided as the procedure is completed. Thanks to the smaller incision and the ability to preserve muscle, the anterior approach allows patients a faster recovery. Anterior hip precautions are fewer, and the patient can expect a faster recovery. There is even equipment available for patients to help them follow their newly prescribed hip precautions. The patient should avoid hip extension and external rotation. They should not bend their operated hip beyond a 90-degree angle. Reachers or pinchers can also be used by a patient to help them grab items from the ground and other areas without breaking the hip precautions. Posterior hip approach surgeries are traditional and the tried and true method of surgical repair. For the posterior approach precautions, the patient should not bend at the hips more than 90 degrees. No adduction. No internal rotation of the surgical legs or feet. Let the patient know they should not twist the upper body when standing. They should expect to sleep on their back and use aids to put on underwear, socks, and shoes for 6 weeks in order to avoid deep hip flexion angles. They may also use an elevated seat in the bathroom. Thank you for watching our YouTube channel. Please support our channel by liking our videos and subscribing to more videos targeting your success.